Gynecomastia. It's very important to watch this video today because you might encounter gynecomastia as a mother, since your child could have it, or you as a son, and you notice gynecomastia in your elderly father, or it might develop in you, a man in the prime of his life. Why does it even occur? What dangers does it pose? And what ways are there to treat it? We will definitely discuss all of this in today's video. Watch until the end and you'll understand what this disease is and how to get rid of it. I'll speak in simple terms so that it's as clear as possible for you. A man doesn't have mammary glands, not milk glands, but actual mammary glands in the way that a woman does. We have rudiments, small beginnings, but under certain factors, they start to grow. And gynecomastia is essentially female-type breasts that appear in a man due to external factors. What could these factors be? Why, for example, does it appear in teenagers? A hormonal surge, when there's an increase in sex hormones during puberty, can lead to what's called juvenile gynecomastia. That is, the appearance of breast tissue in teenagers. In most teenagers, this breast tissue reduces after puberty ends. That is, it goes away and leaves no trace. But unfortunately, in many cases, large nipples develop and a pointed, feminine-looking chest appears. And cosmetically, first of all, it's not very attractive, and it causes a lot of insecurities in young people. That's the first thing. Secondly, it's not very good in terms of oncological concerns, because there's a chance that something could develop in this breast in the future under certain circumstances. Breast cancer is present with an elevated risk compared to the general population. And breast cancer in men is just as aggressive as breast cancer in women. Therefore, if gynecomastia hasn't gone away and you notice your child has breasts that look like a woman's, please pay attention. Sometimes by promptly using a number of medications that lower prolactin or estradiol, it's possible to reduce female sex hormones. If gynecomastia has not lasted long in a person, it can be reduced with medication. In a mature man, this can be a sign of a deficiency in sex hormones. In other words, while in adolescence it's usually caused by an excess, in an adult man, it can be due to a deficiency. That is, because a man is overweight, obese, and not active, he develops a female hormonal background. And accordingly, not only the character changes, not only the behavior changes, not only the body weight changes, but secondary female characteristics also appear. It's not very attractive, it's not very good. And in addition, such glands often hurt, they ache, cause discomfort, itch, and sometimes even galactorrhea begins. Galactorrhea is the discharge of milk. Well, it's not actually milk, but a nipple discharge that resembles milk. It's darker, so it's not milk. But essentially, those are the same milk ducts. That's why these are called transvestites, when transgender transition happens, meaning when someone changes their gender and starts doing it through medical therapy. Not everyone gets implants. Many people actually grow breasts as a result of taking female sex hormones. And for many men, the appearance of such breasts at an older age is a sign that something is wrong with their hormones. And sometimes, when you correct the hormonal balance, there is a partial reduction. When male sex hormone levels increase and female hormones decrease, his breasts shrink. Of course, every gynecomastia consists of several elements. Part of it is fat tissue, part of it is fibrous tissue, and the third component is the gland. And sometimes it's mostly gland and a little fat, and sometimes it's mostly fat and fibrous tissue. The first type of gynecomastia, called false gynecomastia, is often not visible on ultrasound. Essentially, this is gynecomastia. And if the ultrasound specialist says there's nothing there at all, even though it's actually false gynecomastia, this can also be removed, it can be corrected. If it's glandular tissue, why is it important to know that there are different components? Because it doesn't always grow only due to sex hormones. A simple example is professional athletes. The gland can undergo hyperplasia and increase in size due to the use of anabolic drugs, especially if aromatization occurs, meaning the excess testosterone is converted into female sex hormones. Growth can also occur due to prolactin, not just estradiol. Additionally, the gland can grow from the use of growth hormone. Although growth hormone is not a sex hormone, it mainly causes the connective tissue component, the stroma, to grow. Estradiol and prolactin mainly cause the ductal component and the gland itself to grow. That's why even if your sex hormones are normal, but you might have a problem with your mammary gland, you should definitely pay attention to it. Most of the time, a regular ultrasound is enough. But if there are any pathological areas, if you feel there are some suspicious lumps, you definitely can't do without an ultrasound, at the very least. Sometimes an ultrasound alone is insufficient. A biopsy is a medical procedure to confirm there is no underlying issue before treatment can begin. It involves taking a sample of tissue for examination. A biopsy is when a small piece of tissue is taken. No, they don't cut. Usually it's done with a fine needle. A special device shoots a thin needle into the pathological area. And like a harpoon, we take a small tissue sample from there. We give it to the pathologists, and they tell us whether there is cancer, no cancer, or, for example, a precancerous condition. Why is this important? In the case of cancer, a completely different operation is performed, making it crucial. There, the operation involves removing the entire mammary gland along with the nipple. All of it is removed. Sometimes lymph nodes are also taken out. In the case of gynecomastia, the nipple stays in place, and only the hyperplastic and large mammary gland is removed. In other words, this is called a subcutaneous mastectomy. That is, a crescent-shaped incision is made along the lower contour of the areola, where your pigment ends. The nipple is lifted, and the entire gland is carefully removed. The gland, the only thing. About surgeons, I'll probably say separately, who actually needs to have it removed. If it hurts, bothers you, or you don't like how it looks, have it removed. The operation itself takes about an hour to an hour and a half for both sides, if we're talking about both.
There are people who are surprised that you can't just cut everything in the body. There are some consequences. There are certain consequences for the body from removing this.
Only good ones. The consequences are only good. A man doesn't breastfeed his children. He doesn't need the mammary gland by nature. It's a pathological organ that really shouldn't be there. So he has it in a rudimentary form, but there shouldn't be any hyperplasia. And the issue, as I said, is not just about whether it's cosmetically attractive or not. It's also about comfort. There can be discomfort. It can be very bothersome, aching, sometimes itching, and there is discharge. And in addition, there are cancer risks. If it's there, it's like a pathological mole. You don't have to remove it, and you can live your whole life with it. But if it's not very good, it's better to remove it preventively. It's about the same with gynecomastia, especially if it's true gynecomastia and not false. As for the downsides of the surgery, I would say it's the non-cosmetic suture, which, if done by skilled hands, is very delicate and neat, with a small incision because I often see huge incisions. Of course, it's easier to remove through such a large incision, it's easier to do, but the cosmetic result is just terrible. That's why only through a mini access under the nipple, no matter how large it is. The second thing is mandatory wearing of compression garments for 3 to 4 weeks. And it's very important to go through rehabilitation properly, because everything always looks good on the operating table. But during the healing process, the nipples can become inverted and scars may appear. And it's very important to stay in touch with your surgeon so that if this happens, the surgeon can prescribe either physical therapy or give an injection with Lidase. It's a medication that will help the scars dissolve. And plus, an important component also depends on the patient. For the first 2 to 3 weeks, he should follow a protective regimen. No sports, no raising arms high, and reduced physical activity. After 3 to 4 weeks, the opposite applies. He needs to do sports. This helps reduce the scarring process and smooth out the scars. For the final appearance to look good, it takes 3 to 6 months, but if done by skilled hands, the end result is excellent. One of the features is, if you have a large, very large chest, sometimes even a second or third size, and there's real, true glandular tissue there, naturally you will develop excess skin. Some patients with large chests may need more than one surgery to achieve desired aesthetic results. Sometimes removal or reduction of skin flaps is also required, and then a corrective surgery is performed as a second stage. But generally, as the first step, if the chest is large, local liposuction is performed, meaning the fat component is removed, and then they let everything settle a bit. In the second stage, the gynecomastia itself is removed, and if correction is needed, excess skin is also removed. So sometimes this process is even divided into 3 stages. It looks good when the gland is small. It looks good when you have little fat. But if you are overweight and have a lot of fat, then removing a large gland creates a volcano crater, and your nipple collapses. And many surgeons, in order to prevent the nipple from collapsing, although it will still collapse with a large gland, leave part of the gland under the nipple. This should not be done because there will be a high risk of recurrence. That is, you cannot leave a large fragment under the nipple. And it's important, if you have a lot of fat, not to create a volcano, but to do liposuction. That is, at the same time as removing the gland, you should even out the fat surrounding the gland so that it looks good. Because if the indications are only surgical, I can understand that aesthetics come second. But up to 85% of patients get gynecomastia surgery just because they don't like how it looks cosmetically.
A question for parents. They have a child who is 5, 8, or 15 years old, maybe a bit chubby, and maybe he has little breasts like that. So when is this normal and will go away on its own, and when should you actually go and get it checked, just in case?
I can use myself as an example. I was exactly that kind of chubby kid who had gynecomastia, and they removed my gynecomastia much more easily than it should have been done. By that time, I had already developed bad habits like slouching. I had also been wearing oversized clothes, 2 or 3 sizes bigger, for many years just to hide my chest. At that time, I wouldn't swim without a shirt because I was embarrassed. It probably started when I was about 13, and they removed it when I was about 19. That's not very good. That's not really right. And the question is, when your skinny child develops this, and it happens without any apparent reason, well, I can still understand waiting a little bit, watching for a while. But what if your child is not endocrinologically healthy on the outside, if he is overweight, heavy, much bigger than his peers, and has a lot of abnormal fat deposits? Even though he might run a lot and eat a lot, and he doesn't look like you or your spouse, neither now nor when you were young, that means he might have some kind of endocrine disorder. He is experiencing feminization, and his puberty might last longer and may not go very well. Take the child to a good specialist and have them check the child's hormones. That's why you should definitely monitor the chest and hair growth. Is it developing in a male pattern or not? How is he behaving in general? Is he showing interest in the opposite sex or not? Because if you catch delayed sexual development in time, many things, including growth, can be corrected. There can also be endocrine reasons for that. Why is a person short? You notice that he is different. Everyone in the family is tall, but he is short. If you catch it in time, he will grow. Until the growth plates in the bone close, the bone keeps growing, but it grows in width. And on x-rays, you can see whether the bone will keep growing or not. If there is a growth hormone deficiency, administering it will allow the bone to continue growing. However, if the bone has already stopped growing, growth hormone will no longer have any effect. Timing is crucial. Besides diagnosis, it's also essential to do it promptly. I have a small request for you. I would like you to share in the comments any interesting stories related to gynecomastia. Maybe someone has had it removed, or someone is still thinking about it, or you had some experience related to this. Write about it, share your thoughts, and tell us about it. And maybe those people who are still thinking about it and are watching this video right now. After reading your comment, I will take an important step here, in which you will take a direct part and help a person become healthy. Regarding gynecomastia, another important point is that you should discuss this with your surgeon. Even if the ultrasound didn't show anything, even if the biopsy, if it was done, turned out fine. It's crucial that any removed tissue is sent for morphological and histological examination to ensure nothing is overlooked. All removed items are sent for examination. In the last 6 months, several young people have shown precancerous conditions in their test results. The young man saw nothing concerning on the ultrasound. Based on the previous case, his main worry was about the appearance. During the examination, palpation, and feeling, nothing concerned us. But when we sent it, we got a not very good result. Maybe it's worth doing 100 such operations for the sake of beauty, so that for one person, it helps prevent cancer, I think. That's why gynecomastia, it makes everyone smile. But those smiles, among the patients I've met, breast cancer is one of the most aggressive cancers. And if it has metastasized, it's impossible to cure.
For overweight elderly individuals?
For older adults, this frequently indicates a sex hormone deficiency. So, pay attention to your father, especially if he also has a big belly. If he has also become, sluggish, prefers a sedentary lifestyle, doesn't want to do anything, and has become kind of grumpy, there might be a hormonal problem. For an elderly person, removing the breast solely for cosmetic purposes is unnecessary. At an older age, I still recommend focusing not so much on the gynecomastia itself if it appears, And not to rush him into surgery, but to make sure your father or your grandfather has no hormonal issues. Because unfortunately, in our mentality, it's considered normal for an older man to have low testosterone. But that's not normal. Men need testosterone at different levels, but at every age. And when your testosterone is very low, your quality of life will be worse, you won't enjoy life, and you'll have a bunch of related health problems. And if we see that at 65 years old, a person is suffering from hormonal deficiency, their life at 80 or 85, if they even live that long, will be much worse. Without testosterone, he will age quickly. If these are your parents, correctly diagnosing testosterone or sex hormone deficiency in time is crucial to help them, because his life and existence will depend on what you do for him. You asked me if it's possible to get rid of gynecomastia without incisions. Well, it depends on what you mean by that, like completely without surgery. If it's true gynecomastia, it doesn't matter if it's false or not, it's unlikely you'll be able to remove it, especially if it's something that's been there for a while. But, for example, with liposuction, you can remove even fairly large glands. If it's pseudogynecomastia, you just break it up and aspirate it, suck it out, and you get pretty good cosmetic results from that. So, this is done through a puncture. Well, like the tip of a ballpoint pen. It's very neat, and honestly, I like it when you can achieve results with minimal blood loss. There have been patients for whom we decided to do this surgery, and already right on the operating table, at the last moment, we realized that we should still give it a try. We would start, but it would disappear. There was no gland there, because you can't destroy a functioning gland. You can't aspirate it. And you shouldn't do that, because the gland needs to be sent for biopsy. You can't cut it up or crush it. What else applies to a non-incisional approach? We also include medications in the non-incisional approach. There are cases of adolescent gynecomastia in athletes, where we can at least reduce the size, and sometimes even remove it, if it mainly consists of glandular tissue rather than fibrosis and fat. This pathological fat won't go away through weight loss. It's a type of fat trap. That's why, even though it's fat, most often it can only be removed surgically.
Even with intense, rigorous exercise.
Yes, it's a problematic area for fat accumulation. It will be the last to disappear and the first to return, implying it won't go away completely. Medication helps. There is a narrow group of patients. These are the ones we can put on hormone replacement therapy, athletes whose female hormone levels we can correct in time, and teenagers in whom we identify and correct hormonal problems. Yes, the gene can be lost. That's why I'm not advocating for cutting everything and everyone. But for those who need this surgery, it must be performed if there are indications, definitely.
It can happen that an athlete's chest grows while on a hormone cycle. Should he panic?
Listen, but if an athlete's chest is growing during a cycle, it means the cycle is put together incorrectly. The person who assembled this cycle is likely at fault. And I'm not saying you need to quit immediately. It means you need to check estradiol, prolactin, and at the very least, adjust them. He's likely not monitoring his hormones, using drugs that increase prolactin, or not tracking aromatization. Recommend taking an aromatase inhibitor. You don't need to live with gynecomastia. Aromatase inhibitors can block the formation of female sex hormones, because when you use a lot of testosterone, some of it turns into female hormones. These drugs prevent excess testosterone from turning into female hormones, because it's precisely due to the large amount of female sex hormones that your chest grows. And you don't have to endure it. And you don't need to treat yourself blindly. You know how athletes like to do. Your chest has grown, your nipples are itchy, so probably your estradiol is high. And they start doing tests themselves. And only then, because there have been such cases. And, there have been quite a few athletes who developed cancer during a cycle. It's not because the cycle caused it, but because something was already there. And that's not always the case. Imagine, it could just be a coincidence. That can happen. A young man experiences gland and chest pain while cycling, suspecting it's related to the activity. He checks estradiol and prolactin levels, which are normal. Go see a doctor, check what's going on with your chest. It's possible that it just happened in your life, that a pathological focus appeared there while you were on your course. And you just sped up this process, because many tumors, especially malignant ones, are hormone sensitive. They react to high levels of female sex hormones. They use them as food and grow more actively.
Can this also be triggered by growth hormone?
Growth hormone by itself? In principle, in adequate doses, it doesn't cause cancer. But, it's like with smoking. Excessive, prolonged, and uncontrolled use significantly increases cancer risks. But growth hormone will definitely speed up not only muscle mass gain, but also the rate of cancer cell division. That is, all protein processes in the body will accelerate. This explains why cancer patients deteriorate rapidly during a cycle, because testosterone itself causes immunosuppression, meaning it suppresses the immune system. And if, during a cycle, God forbid, someone develops cancer, not because of the cycle, but just during it, they deteriorate as if one day is like 30. In the next episode, we'll talk about male hormones and which hormones are preferable to test for an advanced diagnosis. Where should you get them tested? And how should you prepare for them? And much more that I think will bring you great satisfaction from watching the video. So make sure to hit the bell, subscribe to the channel, and I'll see you in the next episode. All the best.